Hi, my name is Katie Stettheimer, and today I will be presenting Understanding the Gaps Vaping Trends across Southeast Pennsylvania. The Southeastern Pennsylvania Tobacco Control Project is funded through a grant from the Pennsylvania Department of Health and is operated by the Health Promotion Council, an affiliate of Public Health Management Corporation. Evaluation services are provided by the Research and Evaluation Group at PHMC. The targeted region of Pennsylvania counties surrounds but does not include Philadelphia County. The counties that are included in this program are Berks, Bucks, Chester, Delaware, Lancaster, Montgomery, and Schuylkill. The SEPA program currently works with 8 partner organizations that provide tobacco dependence treatment. They include health systems, partnerships, and nonprofits. The treatment protocol calls for at least 4 counseling sessions to be provided by a trained individual, and it also includes optional nicotine replacement therapy. Service providers submit client forms at intake, end of treatment, and a few different follow-up points. All items are self-reported and may be skipped as desired. Data are submitted to Research and Evaluation Group for cleaning and reporting. Our database is hosted and analyzed in SPSS. Our sample today was collected from October 2021 to December 2025, and it includes 2,690 unique responses. The most participants were asked to check all the reasons that they vape or use e-cigarettes from a list of responses that include e-cigarettes are cheaper than other tobacco products, e-cigarettes are more convenient than other tobacco products, I like the flavors, my friends and or family vape or use e-cigarettes, to cut down on other tobacco, to quit other tobacco, use when I cannot smoke or use other tobacco, I like how I feel when I use them, and as a write-in option where they could include their own reason. These are the most common reasons for vaping from each age, gender, and racial or ethnic group. Other gender and race options were available to be selected, but the sample size of the groups are too small for thorough analysis. As you can see, the most common reasons for vaping overall were to cut down other tobacco, and I like the flavors. Notably, the exact same amount of people said that they used vaping to cut down on other tobacco and to quit other tobacco for 2 groups, but not for a third group. So for those who were 61 years of age or older at the time of the program, 44% used it to cut down or to quit other tobacco, and 39% of people who identified as female also said they would use it to cut down or quit other tobacco. However, 51% of people who identified as non-Hispanic, Black, or African American, they said that they would use vaping to cut down on other tobacco. Or a smaller percentage that's not included here said that they used it to quit. So that was an interesting difference between the groups. These are the least common reasons for vaping for each age, gender, and racial or ethnic group. You see that it's I like how I feel when I use them, and my friends and or family vape or use e-cigarettes. So there's less of a social component than you might have expected. Results indicate the need for more robust vaping cessation programming across the SEPA region, as participants continue to utilize vapes for a variety of reasons. Prioritizing inclusive tobacco control programming and resources, implementing targeted interventions, and sharing educational resources on the harms of vaping and flavored tobacco can help close these gaps. Furthermore, the promotion of clean air and flavor banning policies could also prove to be supportive. Here's contact information if you want to learn more about our data or our program. Ansar is the project manager at Research and Evaluation Group, and Aaron Davison is part of the Tobacco Control Division at Health Promotion Council. Here are their emails if you wish to contact them. Thank you very much for your time and attention.